The hair loss encounter is challenging for physicians and for patients. Hair loss psychologically impacts patients in a negative way and often leads to low self-esteem, low self-confidence. So part of the hair loss encounter should really address that aspect of the disease. And so I think a lot of dermatologists may spend so much time talking about the workup and going over history questions regarding medications and lab values and hair care practices potentially, and not spend any time or run out of time to get to, I want to help you feel better about yourself and here's how. And what we can do is offer them a way to camouflage the hair loss using topical powders, concealing lotions, hair pieces of various different sizes, so it doesn't have to be a wig, and would lead to a more self-confidence because you don't have that bald patch or that thinning line in your head. You can also tattoo eyebrows and bald patches on the scalp very effectively. There are multiple different pigments that we can use and different techniques that look very natural. So what I recommend is having a kit in your office. You could buy like a fishing box, toolbox, or an art kit, plastic box, and you just fill it with a few of these options such as the powders, lotions, and a list of the reputable hair piece vendors in the community. So you'll learn about those through your patients and maybe other societies, as well as a list of some reputable tattoo artists for micro tattooing or cosmetic tattooing, whose results you've seen and liked, and who are safe and caring and supportive as well. Sometimes when patients come in with earlier stage hair thinning, it might be nice for them to just consider styling their hair a different way, maybe changing hairdressers, parting their hair off to the side or a zigzag part, coloring the grays, keeping up to date with styles, maybe cutting it shorter so it's not as long and thinning when, let's say, their ponytail is thinning. Just finding ways to kind of spiff things up. And there are lots of ways we can do that. And this may be not something that somebody considered doing. Maybe they were a little bit low maintenance before, but you'll encourage them, you know what, it might be worth your time and a little bit of money to make your hair look better. There's actually a study that showed in alopecia areata patients that they had more self-confidence, they were happier when they wore a wig. So there's some data to show that they do feel more self-confident. I think that my patients' feedback is that they do. That it's just they look younger, and maybe some people compliment them and saying they look better.